the Zika virus, if you get infected with it, have typical flu-like symptoms: fever, rash, joint aches, red eyes, really indistinguishable from other viral illnesses. We start to think about it when someone has traveled to an area that is affected like this. We talk a lot about the Caribbean, Central South America, Brazil. There are urine and blood tests that we can use to confirm the presence of Zika.
Okay, Dr. Hoover, I want to talk to you. 40 million travelers to and from the areas where Zika is actively circulating, primarily Latin America. This was bound to happen here in the U.S., right?
Yes, but even here in the U.S., Zika is primarily an issue related to international travel, and the main recommendations for prevention of Zika really have to do with travelers who plan to travel outside of the United States to areas that are affected by Zika, especially as you were mentioning Latin America and the Caribbean. So pregnant women are advised to postpone travel to those areas, and others who travel to those areas should take very, very careful precautions to avoid mosquito bites, wear lots of repellent, and then when they come back, if they're concerned about preventing sexual transmission, they'll also want to take precautions there.
Dr. Larry, you talked a little bit about the symptoms, and I know that when, for example, if I were to travel to this area, I would take Dr. Hoover's advice and use insect repellent. If I come back, though, and I'm feeling okay, would it help if I continue to use some insectant repellent?
80% of people infected with the virus are not going to show symptoms. So there actually are recommendations if you travel to an infected area to continue using mosquito repellent when you come back, so that the local mosquitoes don't pick up potentially the virus from you, even though you're not symptomatic.
Dr. Hoover, where are we in regards to a vaccine or treatment?
So there isn't an available treatment or vaccine for Zika at this time, unfortunately, and I think we are not going to have a vaccine against Zika in the immediate future.
Okay, so much information, though, coming out each day. Dr. Larry, for your patients who come to you and say, you know, I'm planning to travel, or I just came back from Latin America, what are you advising them?
You know, probably prevention is the best thing. Like Dr. Hoover talked about, what can you do to not get bit by a mosquito? Put on repellent, wear, you know, long protective clothing, mosquito nets, and be in air conditioning.
All right, thank you, Dr. Larry, for joining us today, and also Dr. Cora Hoover. We appreciate it. Again, already 1.5 million people affected there in Brazil with Zika, projected to infect 4 million people worldwide, so a lot of people paying very close attention to this. Thank you both.